Our proposal builds on the current system, where most Americans get their health insurance from their employer. So if you like your plan, you can keep your plan. If you like your doctor, you can keep your doctor.
All right, well, that was President Obama just 1 week before the overhaul became law, and you really heard it over and over again. You can, if you like your health insurance plan and your doctors, you can keep it exactly the way it is. But now one congressman says that research shows that several companies are now seeing an incentive when they run the numbers to drop health care coverage for their employees. And he joins us now. Texas Republican Joe Barton is the ranking member of the House Energy and Commerce Committee. Congressman, good to have you with us today. Welcome.
Glad to be with you.
So you're not saying that these companies have decided that they will drop coverage for their employees, no. Only they look at the numbers and they see that there could be an incentive for them to do so?
Well, not quite. There's a disincentive to maintain it. The penalty in the law, the maximum penalty per employee is $2,000 per person per year. The average cost of major companies' health insurance plans is between $8,000 to $12,000 per employee per year. So the disincentive is to maintain it. They can pay the penalty and in most cases save anywhere from $5,000 to $8,000 per employee. Over 40 companies have already submitted documentation either to their stockholders, Wall Street analysts, or the Securities and Exchange Commission, in which they acknowledge the material effect negatively on their bottom line of this new plan, and that one of their options is to eliminate the health care coverage. Right. So the president didn't understand the bill, or he misled the American people when he made those statements at the top of your segment.
All right, well, we've seen those numbers. We know AT&T and Verizon and Caterpillar, John Deere, all of those companies have come out and said, as they have to do, it's their fiduciary responsibility to their shareholders to say, look, we're going to take this much of a hit because of the health care coverage. But we're not seeing the connection quite yet. I mean, we haven't seen anybody make that leap, right, and say, we've made this decision now. We're going to drop health care coverage because it's simply not beneficial.
Well, the implementation date in most cases is 2014, so they have several years in which to consider their options. But the competitive nature of the American economy is, I think, going to force almost all major companies and small businesses to drop their health care coverage, because it's going to cost them 2, 3, 4 times what it would to just to pay the penalty and put people into the public exchanges if we don't change the law.
Yeah, we'll see what they do when that time comes, as you say. We got this report from the Centers for Medicare and Medicaid Services Office of the Actuary. Tell me about that report being released, and what's your read on it, and are you surprised that it just came out now?
Well, we've asked in a letter that we're sending to Chairman Waxman today, Chairman of the Energy and Commerce Committee, which I serve on, to hold a hearing on that report, because it plainly states that costs are going to go up, that the net effect of the health care legislation is to raise costs, cost the federal government more money, cost the American economy more money. Again, just exactly the opposite of what the president claimed and what the proponents of the legislation claimed as they were passing.
Yeah. All right. Well, you raise a good point, and people do need to be aware that their companies that they work for are probably making that cost-benefit analysis right now. They're trying to figure out whether or not it's going to behoove them to continue to cover people or just to pay the penalty. So it's something everybody at every company really needs to be aware of. Representative Barton, always good to see you. Thank you, sir.
Thank you.